Welcome to the Voyage Clinics podcast. I'm your host, Dr. John Sanders, family physician. And with me today is Dr. Spangler, Diane Spangler. She's a friend of mine. And she did her doctorate at the University of Oregon, go Ducks, and then some postdoc work at Stanford Medical School, correct? With a deep dive really into kind of depression and that. And we did a podcast together on loss and depression, and it was lovely. It was really fun. So I figured we'd talk about the other spectrum of the ship here today, which would be more of the anxiety, the worry, the overly caring processes that sometimes we get stuck in. I wanted to punt the ball to you just a little bit as the expert in this space, and just maybe you could lay out a scaffolding for us to kind of work around.
Well, when I think about anxiety, I think about the the threat system, or what we have built into us to handle challenge or different kinds of challenge. So if you think about that system, it has kind of three prongs that we associate with different sorts of functioning. So if you think about what we associate with fear is about immediate danger and how we respond to immediate danger. And, people are familiar what happens in fear. You have that big rush and, this kind of fight flight sort of a response. And another prong is one that really helps us deal with insult and violation. And that's what we associate typically with anger. And then there's this third prong that is what we typically associate with anxiety, which is designed to help us to deal with potential upcoming challenge. So it's a preparatory state. And a lot of times people think anxiety and fear are the same thing, but they're actually really different, and they're sort of separable in the body and even in the mind in terms of kind of where the mind goes and also how the body reacts. So anxiety is, part of a built-in system we have that's actually really valuable, and it helps us prepare for upcoming challenge, both cognitively and behaviorally and in our bodies. So it really does help us, but it can get overactivated. And if you think about anxiety and its relationship to performance or functionality, it's actually a curvilinear relationship. So this has kind of been mapped out in research sort of over and over again, but it's an upside down U shape. So if we have a moderate amount of anxiety, we actually prepare better and perform better. But if we have a lot of anxiety and worry, it goes way down. And if we have none, our performance and functioning is pretty low. And then we get that kind of curvilinear relationship at moderate levels. It's when our performance and preparation is at its best. And then if we get kind of too anxious and worried, it goes way down again. Super interesting. So I love that kind of framework. Everything in life is biopsychosocial. And yes.
And this is also that. And what's interesting to me here is epinephrine. Epinephrine released by the adrenal glands, but also released in the brainstem.
Yep.
And it's interesting that it doesn't pass the blood-brain barrier when it's released from your adrenal glands. And so when it's circulating in your blood, let's fight or flight, you can remain calm emotionally in that state because there's a different proportion of adrenaline that's released in that fear response. And this is exactly what you're talking about. And
yes.
And the ability to kind of control some of those, and this is what, I'm a big sports guy, right? I play a lot of sports. And how do you maintain the calm in the midst of this massive adrenaline physiologically that you're having from your adrenal glands? I think it's beautiful. It's a lesson learned. And we talk about like how cold plunging does that, right? You're in this adrenaline state and you're trying to maintain a calm in your mind, and how good that is for you to kind of have that. Two other points I wanted to make was the U curve that you mentioned.
Upside down
some
U.
Of it, Some of it is good, like that stress response, a HIIT workout, having some adrenaline, awesome. Actually great for your immune system, great for your body, great for learning.
Absolutely.
The BNF response that happens with that is wonderful. But then if it's prolonged too long, then you start having a decline in the in the positive effects of that on our physiology, on our body.
Yes.
So I just think that's super neat, and it tracks with like the biochemistry of the equation, which is super cool. And then lastly, I think pickleball is obviously the answer here because I'm a pickleball.
Tell me about that.
Well, pickleball is the great control game, right? But it's also the great speed game, and it's like you're hitting the ball really hard, and then you're resetting, and you're trying to maintain a mental sea of glass in the midst of this torrent, right? And this gameplay, and so I don't know. I think it's having opportunities like pickleball where you're in the midst of a stressed situation, whether it's ice cold plunging or a sport or a HIIT exercise, and you're maintaining a mental exertion to remain calm. I think is a tool potentially for the anxiety axis. This phenomenon.
Yes. I want to emphasize a couple of things that you mentioned. One is there are these different components. There's a body component, there's the mind component, there's a behavior component. One of the things that you mentioned is that actually these things operate on a continuum. All of them do. So the body, that sort of adrenaline or epinephrine, that operates on a continuum. And oftentimes when people think about that, they think about, fight, flight, like it's an all or nothing. We're either at 0 or 100. But it really operates on this continuum. And you could think about in a fear state, the body might be highly activated, but in an anxiety state, it's not. It's more of the body's in an on guard state. And so you'll see muscle tension, particularly around, here, shoulders go up to the ears, and then you see it in the jaw. But it's not that fight, flight, really rattled kind of state where people are very activated. And it's more of a muscle tension, and there's a sense of sort of nervousness or activation in the body, but it feels very different from fear in the body. And it's also different from fear in the mind. So, as you're saying, in an anxiety state, you don't have that really strong activation. And so the mind is in a preparatory planning, worry. And so it's useful to be in those states because there are things we need to prepare for, things we need to plan for. But if we go too high and that's overactivated, it doesn't necessarily go into a fear state. It just goes into a chronically high, worried all the time, in prep mode all the time, body tense all the time. Also not good for the body. Again, like some tension, good for the body. But if you're in that state chronically, then people start to feel overwhelmed. Instead of approaching, they want to withdraw. They paralyze in terms of their behavior. They want to avoid, procrastinate. And so again, when you think about that upside down U, when they're in the sort of overly anxious state, it isn't a fear state, but it's a high anxiety state where people often feel, again, paralyzed, a lot of rumination in the mind that doesn't really go anywhere. And instead of worry being constructive, it's non-constructive. It's just rumination that doesn't lead to any sort of problem solving or planning, and usually is just more of a paralyzed state where people feel overwhelmed and want to avoid.
Dr. Spangler, is the root of that? So what you're saying is there's an emotional process in our mind,
there's the emotion usually kind of felt in the body, okay. And then the mind is thoughts and rumination.
Okay. And then that chronically can create a somatization of those emotions. So somatization, yes. So which is like a like the tense shoulders. I see it in the gut a lot.
Oh, yes, good point. Yeah,
all
definitely.
These manifestations of anxiety physiologically. People feel like they're having a heart attack sometimes when they go into the panic attack type thing.
Yeah, which is actually a fear response. So panic is a disruption of the fear system, where anxiety, what you see in the body, is what you're describing, the muscle tension, GI issues, because it's sort of a chronic lift of the sympathetic branch. So then you get some depression of the parasympathetic. So that's where all that gut issue comes from. Sure. But it's not at a fear state. So when people are having a panic attack, that's a false alarm. That's a fear state.
Yeah.
So you usually don't see that with anxiety. Now, people who struggle with chronic anxiety and chronic worry can sometimes also have panic issues, but many don't. So in a clinical state, if someone is really chronically, constantly worried and in that tense state, which isn't a fear state, we call that generalized anxiety disorder.
Okay.
And but again, there's sort of a continuum that leads up to that. So there's people that are sort of high in the worry and that kind of thing that might not quite fall into generalized anxiety disorder. And what you're describing, someone having a panic attack, that's really panic disorder, which is separate from like a general anxiety disorder.
If I can just one more thing that I see clinically with folks that are just too anxious, there's too much epinephrine flowing around, and
yes,
they're just super anxious. And I think it's part of the upside down U is that the downside of that is probably cortisol has a lot to do with that. Our chronic stressed state. I mean, our society is probably really high octane, very stressed, leading to chronically high cortisol. And chronically high cortisol physiologically, it disrupts our sleep. It causes more visceral fat, more abdominal fat, and more cardiovascular risks. A whole bunch of risk factors come with that chronically stressed state. So let's talk about how to worry just the right amount. So there's overly worrying, and then there's a reasonable amount of worrying, and how do we kind of combat that, or how do we at least recognize that we're doing it, and then how do we disrupt that or break that or change that? I have some clients that, gosh, I've been working with them for a long time, right? And I've sent them to people like you. I sent them to therapists. I sent them for counseling, and I start them on these medicines that work for this stuff. They're evidence-based, and yet they still have this propensity to be like, oh my gosh, what if this, and what if this? And it's almost a neural programming, and some of them it's generational neural programming, because like my dad does this and my mom does this, and my grandma does this, and we just have it in our genes. And I'm like, well, maybe it's in your genes, but maybe it's also just socially taught in your environment. And so we need to kind of recalibrate that. How do I acclimate my worry compass? How do I fix that?
Okay. So again, you mentioned two sort of somewhat separate components are really important to address both. So one is that kind of reactivity of the body. And there does seem to be evidence that there is a genetic component to that in terms of how reactive the body is to stress or challenge. So there might be people that come a little high normal or a little lower in terms of just where their body is in terms of reactivity to upcoming challenge or stress. So that's kind of where the medication piece is probably the most helpful, is if someone's body kind of comes high on those things. Although there's experiences that one can have in life that push the body higher on that continuum. But then there's the
whether it's increasing the buffer or decreasing the buffer.
Correct.
I kind of break this down as a buffer. Folks have a buffer toward anxiety.
Yes.
And some folks buffer.
I'm going to call it reactivity, but yes, that's the body part. Right. They sort of have a reaction range kind of a thing.
And then some things in life will increase it. Some things will chisel it down.
Yeah. Some will raise you and some will lower you.
Yep.
So something like meditation, for example, can lower body reactivity. There are certain experiences people can have, like traumas, that really up reactivity. So those would just be some examples. So that's the kind of body piece. And then there's the mind piece, which is that kind of what if thinking. How prepared do I need to be? Do I need to prepare all the time? A lot of that is probably learned, although there may be some cognitive patterns that sort of come to, that we're sort of born with, and there's all this sort of interesting research that I don't think anybody has the full conclusion to draw about if sort of prepared learning, that if parents really prepare learning in a certain way, that maybe some of that cognitive structure could be passed down. But that's still, the data are out on that. But there's some data that supports that. So if your parent is really good at music, for example, and really hones that skill and becomes, a lovely pianist or something, that maybe that their children would be more prepared to learn that. But of course, it's really hard to separate from them then being born into a family that's interested in music and plays a lot of music and emphasizes that. So it's, those things are hard to kind of pull apart.
I'm glad you mentioned the preparation part, because we live in Utah. Utah has a lot of preppers, and so,
yes.
So some of these folks are like extremely worried about the future to a nth degree, and they're extremely well prepared.
Yes.
but they're quite worried about it, even though they're well prepared. And some folks are just like, I'm fine. I got a little bit of food storage. I should be good. I don't know. It's just that there's, it's interesting that there's a spectrum of that worry.
Like how prepared should I be, and
totally.
how often do I need to be in the prepared state? Now, I don't think that these are necessarily deliberate decisions we make, and we do pick that up. We're like a sponge, kind of from our. So when you say, well, my dad and my mom are super prepared, and that's really going to affect a person, because then they're just going to sort of, one should really be preparing all the time, and it's important to always be prepared and be thinking about being prepared. And so that's actually, those sorts of ideas are things that start to differentiate people who can be in that mid-range of the curve, and then be flexible and come down to no worry when you don't really need to be preparing for something, versus people who kind of get stuck in that chronic high level. That is some of their beliefs about worry and anxiety themselves, about those exact things. So that's part of what differentiates. So that people who are at risk, you might say, for chronic worry and rumination tend to have some really interesting beliefs about worry. One of which is that I should be worried kind of all the time, and that I need to be in prep mode all the time.
It's my job, it's my responsibility type
exactly.
thing.
And doing that is a good thing to do. It's an important thing to do, and it can show caring for other people, so that if I'm worrying about people all the time, that's a way that I care for people. So sometimes you see these sort of intersections of beliefs too, that believe that worry is something to be really valued, and it's something to, and I would say worry is something to be valued, in the sense that we do need to do some amount of prep and worry, and it is a valuable thing. But it's like, I need to be worried all the time. That's how I show other people that I care about them, or that's how I'm a responsible person. So you'll also see beliefs about sort of what I might call over-responsibility, that to be a good person and to be a responsible person, then I need to be planning all the time and sort of working all the time and thinking ahead all the time. And that's how you're a good, responsible person. Or a caring person, so there's these sort of beliefs around needing to be in that state, and that's a state that one should kind of always be in. And sometimes these are sort of hidden to people, that they're worried all the time, and then they can have actually worry about the worry. So we call it meta worry. That like, if I'm not worried all the time, then I'm worried that I'm not worried. Or you can also see it happen that they want to be in this worried state, and then they get into this worried state, and then they worry about, I'm worried all the time, and it's going to take over, and it's uncontrollable. And so it's this sort of vicious cycle that develops.
Yeah.
But there are these sort of beliefs about worry that you see with people who are in chronic states of worry and anxiety. That's the body part of, worry can certainly, as we're trying to challenge and prepare, get ready for those challenges, the worry can create those body states. So there's always an interaction.
This is super cool. And this is if we could put another pin in emotional intelligence work, I think it's so beautiful. And we talked about it at our previous podcast, how important doing the work, the deep emotional work to figure this out. And it is not readily apparent. When someone is stuck in the worry cycle, they don't see, I've been in some of these cycles, not with worry.
Of course, I think we all have it sometime or another.
I haven't recognized that the belief about that worry. What is it that I believe? What is the core start of that worry? And how stuck am I on that, And I think, are there any other like beliefs that people hold to that create this? That you mentioned this one, I think it's wonderful. Are there any others that folks can like, oh, I'm that kind of,
yeah,
I dive into that, and yes, I do that too. Like, are there some others?
So a couple that we've discussed already is just like, I need to worry to be a caring person.
Yeah.
Like if I'm not worried, then I'm not caring. I need to be worried all the time to be prepared or responsible. And then there's the sort of catastrophizing piece of it, that if I'm not in this state all the time, kind of worried, preparing, or much of the time, so then something terrible is going to happen. And there's this sense of doom. And usually when you dive into that sense of doom, it's sort of falls apart, because it's like, well, what would really happen? And it's like, well, and you'd have to do it with a specific worry. And then when you get to, well, what is likely to happen? So if X does happen, the what ifing, okay, what if that does happen? what's the worst thing? And then how would you deal with it? And then people it starts to just kind of disappear. Oh, well, I guess I would do X, Y, and Z, and it wouldn't be the worst thing. So that one could actually get to, okay, well then is there anything that you need to do to prepare for that worst thing? And then you can have specific action items. And sometimes there isn't. And if there's nothing you can do to prepare for it, then it becomes non-constructive worry, or what I might call rumination. Because you can think about it over and over and again, but if there's really nothing you can do about it, what's the point of ruminating?
It sounds like a little bit...
So constructive worry should always lead you to action items.
And then do the action item.
You got it. Yep. Then do the action items.
Cool.
And that's what worry's for. And it's, again, very valuable.
Yeah.
There's lots of things we need to prepare for.
That's super helpful. Help me to worry appropriately.
Okay.
That's super great. So
yeah.
that helps me, because if you're worrying appropriately, you're going to do a thing. Give me an example.
Okay. So I'll give you an example, and then I'll give the listeners or the viewers an exercise to do, or a technique to use.
Oh.
But an example would be, okay, do you remember when COVID first hit in 2020 here in Utah? And things had just sort of been shut down for maybe a few weeks, and people were already worried, right? Like the anxiety was up, and people worried about COVID. And then we had that earthquake. Do you remember that?
Totally.
Okay.
It was the end times.
Yeah. So we had that earthquake, which didn't really do much damage. It was a pretty mild earthquake. But then there was just this explosion, and I definitely saw it in patients in my office, around worry around earthquakes, right? So, okay. Earthquakes, can they happen in Utah? Absolutely. We're on the fault lines. So are earthquakes something we need to prepare for? Yeah, probably. But people were thinking about earthquakes all of the time, a lot of rumination, and really anxious, already anxious because of COVID, and now really focused on earthquakes. And what can I do? And I'm anxious all the time, and people weren't sleeping, and couldn't concentrate and things like that.
And we were stuck in our homes.
We were
doing less. We were doing less.
Yeah. So that's sort of this context. So, but people were thinking about earthquakes in a way that maybe they really hadn't before, especially being in Utah. Having myself lived in California, it's like, well, I've thought about earthquakes, and it was sort of nothing new. But maybe people in Utah hadn't thought that much about earthquakes. And so this was this new threat. And so kind of thinking about it all the time, feeling anxious all the time. What do I do? What do I do? What if we have another one? What if my house falls down? What if, thinking about, okay, so need to prepare for earthquakes. What is, the likelihood that we'll have an earthquake? Well, kind of hard to say, but, we are on fault lines, so we can have earthquakes. Okay. So what is the worst that could happen? Well, there might be damage to my home. I'm going to want to be able to be in contact with my family members and know where they are and be able to meet with them, or, have a meetup point or something if there is an earthquake. I'm going to want to have some amount of like water and food available and things like that. Okay. So, you can kind of take it to its worst possible thing. What happens if there's an earthquake? What are the worst things that can happen? Okay, so you worry about that, and you go as far into it as you can. And then
as far as the worst possible.
Yeah,
thing.
the worst possible.
Yeah. So recognize the worry, the source of the worry, and then lean into it. Almost expose your exposure therapy to the worry.
Yes.
And then
I could be injured. Okay. Well, then I want to have some first. So go as far into as you can. Let yourself get real worried. So go into this sort of catastrophe, and then so I've got my worst case scenario, and then think about, okay, are there any action items I can do to prepare right now? Or, in the present moment? Yeah, I think I want to check on my 72-hour kits. I want to make sure, I've got one in the car and enough 72-hour kits for people at home. I want to be sure we have some amount of extra food and water, a light source, again, sort of 72-hour kit kind of stuff. I think I want to look into earthquake insurance for the house.
Cool.
So, all
and that's
right.
something you can actionable.
Yeah. So these things are the action items, right? So you write them down. You don't necessarily do them in that very moment, but you write them down and be like, okay, so now I have my action items, and then you start to act on your action items, in the next few weeks or whatever it is. You start to plan on those. Maybe you call an insurance agent, hey, to tell me about earthquake insurance, and you develop a family plan about how are we going to get in touch with each other if there's an emergency, and make sure you've got enough of the necessities and that sort of thing. Okay. So then the next time that the thoughts around earthquakes come up, instead of what ifing and oh no, and what do I do about earthquakes, and there's all these terrible things could happen, it's like, oh, well, I've considered that already. And I've done my action items. So I could think about earthquakes over and over and over again and ruminate, but will that change anything about my preparedness? And will that change anything about the likelihood of it happening? So if I think about earthquakes a lot and how I would prepare, is that going to change what happens if there is one, or the likelihood of an earthquake happening? No. I mean, I can think about them all the time if I want to, but it just makes me upset. And it's like my action items are either done or on a list, and I'm going to get to them. So is there anything else I really can prepare for? No, I've done what I can do. I've protected my house. I have necessities. So if I could think about it over and over and over again, but see, that would be non-constructive worry, or what I might call rumination. What's the point?
That is such a great process to just hear you kind of walk me through. I think it's super neat to see the solutions to some of the worry cycles, and how to create constructive ways through it, and then process it. And it's liberating to the person who's stuck in that cycle. I could imagine
gives you a place to go.
I have a plan, and then I have a thought process there. And so next time, if that worry comes back, I just follow that road to the process that I've already I've already done actionable things on. And then probably it's liberating from that worry down the road. Each time it happens, it's less.
You got it. That's exactly what happens, is that worry decays because there's just sort of nothing to do. It's served its purpose.
Let's go deeper into the kind of the belief system around worry. Is that something that, because I've never done that. Like, I don't have it as much. I have a very reasonable amount of worry. I don't know if it was taught by me. I've been trying to Rolodex back through my memories and my mom and the way, I grew up in a little bit dysfunctional home, and we talked about it last podcast, like my dad was an alcoholic, and there were plenty of things to worry about. But I don't know how I got reasonably emotionally regulated here, how my belief system around worry became reasonable. And I wonder if there's a space here we can probe and discover something in just kind of the root of it. If there's a belief system that is creating that propensity, maybe I can look back at the way that I see myself, the way that I see, the way that I emotionally process this, and is there a way to recalibrate that belief system a little bit and change that? I mean, I would say the process you took me through is very, very cerebral frontal cortex process, and it's wonderful for ameliorating that. But the propensity, the belief system, the deeper space of, I feel like there's maybe a deeper space there to maybe change and recognize.
Yeah. So what you're talking about is more core beliefs about worry itself that can also sort of involve identity and how one ought to be in the world. So before we pivot there, though, I do want to be a little more, I gave you an example of the earthquake. I want to be a bit more, before we leave that, clear about how to use that technique and what it's called, so that people can apply it and use it themselves. So it's actually called worry time, or some people prefer to label it differently, like planning time. But if you have worries that run across your mind, and you are someone who has chronic worry and they feel almost intrusive, but they're sort of there, when you have a worried what if kind of thought that comes across your mind, for some people, they experience that much of the day. that those kinds of thoughts can feel very demanding in terms of attention.
Right now.
And they feel urgent. And so when you have those thoughts, they're going to try and present as you need to turn your attention to me right now, and you need to, those thoughts need to take over. So that is the feeling people have and the sense that they have. So worry time can be used to start to challenge that. You could think of that as almost a thought about worries themselves, that when they cross your mind, they need to be dived into it in that moment and kind of take over. And most people who have that sort of chronic worry will say that their worries do feel uncontrollable in that way. It's like they just demand my mental space, and I am worried all day long, and it's, So when you have those thoughts, then you start to create a list. So, and you can do on your phone in the notes section or on a piece of paper or whatever, but you just note it. So with the earthquake example, if you had a lot of intrusive thoughts about earthquakes, you'd say, okay, earthquakes, I'm going to put you on the list. And it's just a bullet point. It's not a whole journal entry. It's just earthquakes. So I need to worry about that. And then maybe you have other thoughts about finances or your kids' safety or whatever. So it's like kids' safety, I need to worry about that. Finances, I need to worry about that. And so you have this like list of bullets. And then you set aside, if you're someone who's a chronic worrier, you probably would do this initially on a daily basis, although most people can start to wean away from daily if they want to, once they kind of get more control over their worry process. But so that you note it and say, oh yeah, okay, earthquakes. I'm having all these intrusive thoughts about earthquakes. So I'm going to put you on the list. You got your own bullet, earthquakes. So that as you're going about your day, when you get assaulted essentially by those thoughts, you can be like, okay, yeah, you're on the list. Like, so noted. You're important. Like, I care about you, worry system. You're helpful. You're a good thing. And then you set aside a half an hour a day. And for the first 20 minutes, you pick the worry that's kind of most bothersome that day. You pick that one, and then you go fully into the worst case scenario. Like I did with the earthquake, what's going to happen? Someone's going to get injured, or I'm not going to have food or water, or my house is going to be, cracked or something, and I can't stay in it. Okay, so go to the full thing. So you let it play out to its worst possible scenario for the first 20 minutes. And most people who worry a lot will say, 20 minutes is nothing. Like, I worry all day long. What do you mean? And it's like, okay, but people actually have trouble staying on a single worry for 20 minutes. And it's surprising to them because typically when we start to worry, we ping pong, and then we ping pong to another worry and another worry. So we never go to the full, what's the worst that could possibly happen, because we ping pong all around. So nothing gets resolved, and we just ruminate and jump around and feel terrible. So staying on one thing for 20 minutes in a worried, well, what's the worst thing that could happen? Okay, if that happened, well, then what would be the worst thing? Or is actually difficult for people, but they'll do it. So you stay on it for 20 minutes. The last 10 minutes of that 30 minutes is when you come up with action items. So is there any action items that I need to do? And some of the time the answer is yes. So you write them down, and then you on a separate kind of action item list. And then, it's things you take care of, again, not in those 10 minutes, but it's at some point. So you address them. If there are no action items, then that is a really good sign that is non-constructive worry or rumination, because it's like, there is nothing I can actually do about this. So there's no preparation to do. So again, constructive worry will always lead to action items, preparation items, because that's its point, is to prepare you for a potential upcoming challenge. So if you're just ruminating and it's non-constructive, then you can be like, okay, I can turn this over in my mind 24/7 for the next year, but it's going to get me nowhere. Just like the example that I gave about if I kept worrying about earthquakes after I did my action items, it's not going to change the probability of an earthquake. My worrying about an earthquake isn't going to do anything. Earthquakes are going to happen or they're not. and it's not going to change my preparation state because I've already done what I could do.
This is a beautiful tool.
Yeah.
What is it called again? The worry time?
It's called worry time.
Worry time or your planning time or whatever.
Yeah.
I love it. I think these kinds of tools are emotional judo. And it's how we just karate chop those are two different things, but still, it's how we karate chop our emotions into check, and just put a pin in it, put it on a list, and I'm going to put aside some constructive worry time later today.
It also honors it.
It does. It validates it.
Because worry is important and planning is important. And there are many things we need to prepare for. But then the one that you've just done, that you've taken off the bullet list, and this is what you mentioned when you were talking about the earthquake example, is the next time those thoughts come, they've been, the wind is out of their sails because you're like, oh, here you are again. I crossed you off the list. I could put you back on the list and do another worry time around whatever it was. But the motivation is way lowered because you're like, I already did that one and I think I'm done. So initially people have a long list that quickly gets winnowed down. And sometimes you'll come to your list during worry time and there'll be worries on there. You're like, okay, that's already over, or I'm not even, and you just delete them without even doing the worry time on them.
Cool.
So worry time kind of helps you go through your worries and then do whatever constructive preparation you need to do. It also tests some of the more overt beliefs about worry, like that if a worry comes across my mind, I have to dive into it. So that worry thoughts don't get to be as demanding.
Right.
So it tests urgency, and it also tests a really important piece of people, typically people who have chronic worry, is that I need to worry indefinitely or constantly in order to come up with solutions. That worrying 20 minutes a day is probably enough for most problems. And that is a revelation to people who worry a lot.
That's super cool. And it's super cool that it tests the core of, like, by so doing this process, it's really addressing the core belief around worry, like you said, like, and maybe even it's opening windows for emotional intelligence. Like, you can now discover a little bit deeper into the core of your worry through this process. That's super cool. Actionable. So
it hits on the worry about worry. Like, if I'm not worrying, then what's going to happen? Yeah. And most people who have chronic worry think that something terrible will happen if I don't worry all the time, or if I'm not in a prep state all the time, both body and mind. And so worry time is a way to experiment with, well, what does happen? So if you only worry 20 minutes a day, what happens? And like, does the world fall in? Because that fear is strong, or that worry, that sense of doom, that catastrophizing is really strong, but it's usually vague. It's just like, I need to be worried all the time or else, right? And so it's a really fun for me. I don't know, so fun for the people I'm working with, but for them to actually test, well, what happens if I don't worry all day long?
I have two thoughts. One is, I have a friend who is, in maybe the higher worry state person. And her doc, she's been working with a doc, and her doc says, you're kind of in an under-stressed state. Like, I forget what the diagnosis was, but it was something like not enough stress in life, and you need to like create more things that are hard for you. Maybe like more high intensity training intervals, like ice baths, like things that create stress in your life and hard things. And I think it was interesting because I don't know that she was going through enough hard things to really stop worrying, right? I apply that. She was just kind of in this
avoidant.
I don't know. She's just in this chronic worried state. And the doc was like, well, you need more stress in your life. Go mountain biking and go stress your body and feel those things. And it kind of puts that into kind of check. I think about this application of this is very fascinating to me. And I was wondering, why am I not a worrier? Why do I have a reasonably appropriate degree of worry in my life? And I think I went through some really, really, really hard things as a young person. And And when you go through really hard things, you recognize you're not in control, and you recognize that I can worry about mom and dad splitting up a lot, but can I do anything about it?
Correct.
And you're just forced into it. The worst thing is my brother to die, and he died. And so I was forced into that situation, and there was nothing I could do about it. And so I think there's a release, a letting go that happens if you go through some really hard things. And maybe that's the, you called it not the buffer, you called it the threshold or something else. I forget what, but you called it where your threshold to worry it gets bigger through maybe some of these harder things that you endure. And then you get used to like, there's nothing I could do about that hard thing. And you recognize through life that there's many hard things that could happen, and there's not a lot I can do about them. So I'm just going to do what I can, and then I'm going to let everything else go.
I'm so glad you brought that up, because part of some of the work that can be really helpful for people is what we call feared fantasy. That's part of that. Well, what if that did happen? What's the worst possible thing that could happen? And then what's the worst possible thing after that? And you really get down to it. Like, what is the person most afraid of or concerned, will happen? And then there's, this idea that, well, what would I do? I couldn't cope. Or so that's kind of a feared fantasy technique. But when you actually experience some of your worst feared fantasy, so it's not a fantasy anymore. Like, my brother did die, is kind of what you're saying. And that you realize, and I survive it. Yeah. And so kind of worrying about all these things that could happen is that you have this sense of that I'll cope with it. I'll figure out what to do when it happens. And that there are many things that we actually don't need to prepare for. And that you also mentioned this sense of recognizing that there's a limited amount of control that we often have over the things that we're most concerned about. And that allowing for that sort of lack of control also allows for less worry, because worry is an attempt to prepare for something. And if you decide, I can't really prepare for that, then worry sort of dissipates. So I, like you, have had the opportunity to live through some feared fantasies of my own.
Sure.
And how liberating it was.
Yeah.
Like, here I am with nothing. And it's like, oh, I'm okay.
That's what that feels like.
Yeah.
Yeah. Yeah. There's an interesting book that I was teaching at a direct primary care. Family doctors all get together and talk about reconstructing the healthcare system. And Voyage Clinics is one of this kind of model of caring for people with like a membership. Anyway, my wife and I were teaching at a conference in Costa Rica just a month ago. And one of the doctors there told me, we were going through all these pain points of running a practice and starting it up and figuring out all these things. And one of these doctors, she mentioned this book. She's like, hands down, this is the best book ever for business owners and for this and that. And it's called The Four Contracts. So I'm like, oh, that sounds interesting. Maybe it's a legal book or something. So
was it The Four Agreements?
The Four Agreements. Thank you.
Yes.
Thank you. And so so I look it up and I listen to it on Audible, and I thought, oh, that's really interesting. That's like nothing to do with business at all. It's all about kind of belief systems. And but in that book, it was fascinating. They talk about this where I don't remember how he says it. It's kind of a shamanistic type of a view on like, healing and wellness and emotional wellness. And it's neat. I think it has some insight, and I think it's neat. One of the chapters is the agreement with like, I forget, I'm going to be remiss at quoting this, and I'm not going to quote it. So I'm just going to paraphrase it a little bit. He talks about like just facing the angel of death, or the destroying angel. And the worst thing that could happen is, I lose everything. I die. Someone around me dies. I lose my business. It's the destroyer, right? And face that and look at that. And I think that's what we're talking about, is going down that pathway where you're like, the worst thing that could happen here, right?
Yes.
Or experiencing some of that death and some of that loss and some of those really worst case scenarios. and how it galvanizes you and
It can.
It can.
Yeah.
And maybe appropriatizes you if you allow yourself to release it, allow yourself to let it go. The perception that you have control of any of this stuff, and just, it doesn't mean you're a total hippie and you're just kind of grooving along with the world and not preparing for anything. But I think that it really calibrates an appropriateness to at least to my worry, if I can just learn to breathe and let things go that I don't have control over and I can't do anything about.
Yes. Yeah. Well put. Far less worried after you confront either in an imaginal or cognitive way or in actual life, when you confront those, like, what's the worst possible thing that's going to happen with all this what ifing, that there's can be something so very freeing about it. Mm-hmm. I can give another example of that, of someone who's coming to mind, but
Please,
if you'd like. But,
yes.
but before I do that, I did want to address the example that you brought up about this woman who she was working with was saying you need to be more stressed, that she was worried all the time and sort of wasn't doing anything. I might actually look at that as someone who's in the tail end of that and when you're very worried, there is sort of a paralysis and avoidance, a procrastination, everything's overwhelming. So obviously, I don't know who this person is, and don't want to conjecture too far. But that part of that is, I would say, like, okay, then there's probably some action items that person would do that would unstick them.
Okay.
So maybe that's kind of what that other provider was trying to get at, is just like, take some action. And it'll, it helps complete the stress response in the body if you take action, whether that's exercise or, doing action items or whatever. But it also, it helps you get out of that paralysis frozen that can happen when you're at that really high level of chronic worry and anxiety.
And to your point, I mean, I've managed medically people who are catatonic, which is to say they're like physiologically stuck. They can't really move. And it's interesting, but like, this is the deepest of deep cycles of the lowest part of the U on the pathological end, if you will, and often requiring like hospitalization and intensive psychotherapies and medicines and things. And I had a gal who was stuck in that, and
which was probably additional things going on besides the anxiety that we're talking about.
100%. But she got better, and she's like wonderful now. But she was in the deepest part of that space. It was super, super rough. Yeah. But she's like back to being super okay now. It's super great.
Oh,
and I think that's good to see, like, the healing cycle of this, and for folks to know that there is a path forward where you can feel total resolution of this and have that emotional regulation be more calibrated. It's good. I'm sure you've seen it a million times.
Yes, and it's just wonderful every time, to see people kind of bloom again after they've, feel like they're completely wilted, and it's just, it's wonderful.
Did you have an example?
Oh, so not of that, but we were talking about that kind of feared fantasy and whether you do that in sort of almost an imaginal cognitive way, or you actually have those circumstances occur. But just as sort of almost a simple example. So I was a professor for many years and still do some teaching and research, but I would see, my exams were hard. And so
really?
I have high expectations of my students, and I'd mostly teach grad students, so my expectations were quite high. And so some students would not perform as well as they had wanted to on exams, and they were typically, generally speaking, very good students, and so weren't used to not performing well on exams. And so they would maybe get back their first midterm and just be crushed. Like maybe during their first year of grad school, it's like a whole nother level of learning, and they're just sort of crushed. And so they would sort of come in my office, just sort of with their tail between their legs, kind of a thing, like, I did terrible on this, and just really upset. And feeling very anxious, like I'm not going to make it through grad school. I thought I was really smart. Now I feel like I'm really dumb and really worried, very anxious. I got this terrible grade, and I'm gonna, so I'm gonna fail the class, whatever. So okay, so let's do the feared fantasy. I'm going to fail this class. Okay. And if you fail this class, what's the worst thing that could happen? And they would think, well, when I take them down the line, they'd be like, well, I'm going to fail out of school, and then I'm never going to get a job, and I'm going to have a bunch of student debt, and I'm going to be homeless, and I'm going to, so we go all the way down, and then we could look at each one of those and sort of work on it. So if they actually fail that exam, it actually doesn't mean they're going to fail the class, because they've got other exams and term papers and things like that. And if they failed the class, they actually wouldn't be kicked out of the program. They'd have to retake the class, and the likelihood that they do better the next time is probably much higher, that kind of thing. But if we go all the way down to I'm going to be homeless, living on the street, I'll never have a career, and it's like, okay, well, let's take that scenario. So let's say you do get kicked out of school and you have all this student debt and you can't get a job and it's like, okay, so you're homeless. What would you do? And it's people sometimes even almost laugh at that point. It's like, well, what would I do? Well, I'd probably ask my parents if I could move in, or I'd, go sleep on a buddy's couch, or I'd, and what would life be like? Well, actually, I wouldn't be stressed because I wouldn't be worried about graduate school and all the, and then people are kind of like, actually, it might be kind of cool. Like all these expectations that they had for themselves and everyone else, they get to be freed from those. And it's like, I would kind of be free. Like I could just sort of be a blank slate and kind of start all over. And what would I really want to do? And man, graduate school is really stressful. And I'm not trying to convince people to leave grad school, but it's like, oh, that wouldn't be so horrible. And I would figure it out, like I'd find somewhere to live, or I'd go to a homeless shelter, I'd do something. And then I'd rebuild something, like I would, and so that's sort of an example of where that feared fantasy can go, even if it's just imaginal. And then all of a sudden, failing that one test is so minuscule. It's like, oh, well, okay, well, I'll just try harder the next time. Or if I have to retake this class, I guess I have to retake this class. And it's like, so the worst of that is that you have to spend a whole another semester with me, like it's not the worst thing. Yeah. They could tolerate it.
They could probably tolerate it. This is such a cool story. And it reminds me of a wonderful conversation I had with my 17-year-old this last week. We were just on a drive and talking, and it's just wonderful. These my kids, I love teenagers. And I've got a 20-year-old, a 21-year-old, a 19-year-old, 17, and a 14-year-old. And they're all just learning and growing and emotionally and all the other things. And I would say
very plastic time of life.
Very neuroplastic.
A lot going on.
It is super neat. Like, wow. It's really fun. They're changing and growing every day. This has to do with the how to care just enough. And the type A learners, which I don't know where she got this from, but her mother and I are both pretty type A learners. We're like straight A's and gotta do well. And I try not to impose a ton of pressure on my kids. She's been very awesome. My younger kid, I have to give him a little nudge here and there. But she's so neat. We were driving along and she says, "Dad, we were talking about grades," and she says, "Dad, I got an A- this semester." And I was like, "Really?" She's like, "Yeah." I said, "Well, how do you feel about that?" And she's like, "You know what? I'm okay with it." And I said, "Well, tell me about that." This is okay. This is not like the perfect dad situation. There was a time when I would respond very differently to that. But I've grown. As a parent, I'm more, better at validating and listening and hearing. So this is a decent story about that. So she says, Dad, it's actually, I've seen it be really unhealthy. Like when I was a sophomore, I remember I got an A- then as well. And I looked at it and I processed it and I said, you know what? It's okay. It doesn't matter if I get an A-. What's the worst thing that can happen, right? She went down the worst thing that can happen.
Nice.
And she went down that path, and then she was able to see it and say, it's okay. And she says, there are kids in my school that take easy classes just so they can maintain the 4.0 GPA thing. I take some really hard classes. She's taking very hard classes. And sometimes it means an A- for me. and I'm okay with that. And I'm like, bless you, girl. I don't know how you got so emotional intelligent, but that is wonderful that you have that. That is high level emotional intelligence that you can. It took me middle of med school to figure that out. Like I was straight A's and very type A. And then in med school, I'm like, I can't get straight A's in med school. It's not possible. I mean, it is if I spend the curve on a A+ versus a B+ is another huge. 20 hours of study, and I have kids and I have a family and I have to balance this somehow. Yeah. But man, for her to already have that emotional intelligence to care just enough, right? And I think
so. I would frame that a little bit differently and say that she's considering what she's in school for. Meaning, if you think about the beliefs, one could say there's a performance mindset that you can go into school with. It's just about getting good grades and all that. But there's also what you might think of as a learning mindset, where, like she's saying, I'm taking these classes because I want to learn these things that are hard. And so my performance, in a sense, might take a hit. But what's important to me is what I learn. And so she's caring quite a bit, but what she's caring about is less performance and more learning or growth or expanding her intellectual horizons or however you want to think about. I don't know exactly how she would term it. Some people might call it a growth mindset, but she's caring a lot, just not about performance as much. It's not like it's a 100% all or nothing, 0%, 100%, but there's something else that trumps the performance. She cares about her performance and, wants to do well and master what she's learning, but it's what she's getting out of it that trumps that. And so she's caring maybe about something that is potentially healthier or helps her have a different kind of experience in school that is much more, less pressured, much more, again, just sort of expansive.
Yeah. I love what you just did with me, which is super cool. You said, let me help you frame that differently. It's just so much more healthy to frame it the way you just helped me frame it. And instead of like, she doesn't care about school as much as, but you said, no, she actually does. She just cares about it in an appropriate way or in a different way.
A different way, yeah.
Which is really neat. The premise of caring just enough is just, I guess it's clickbait because I want folks to kind of work on that space a little bit. My other daughter is she's very empathetic. She's like very intuitive, and she's just a different
an empath.
She is very empathetic. Aww. And she cares about what other people are thinking and saying and feeling. And that's really, really hard for her because she gets emotionally distraught from other people's stuff. Yeah. My daughter, who we're talking about, my senior in high school, this one's on a mission right now, but in Rome. But my daughter, who we're talking about now, is very, she has wonderful emotional boundaries. She's like, no, I don't care about you and your thing over there and your gossip over here. She just has, she's not as, I don't know that she's not a sociopath. She's not a narcissist, but she's just, she cares enough or differently about those things. She does care about them, but she doesn't allow them to pierce her emotions and to affect her. And she had to learn that. She had some unraveling friendships that were really hard for her. And then she kind of said, well, I need to put some boundaries around my heart and then say, I care just enough about the way other people think and things like that. Whereas my other daughter, being super empathetic, it's hard for her emotionally. And there are folks out there that are that way. And I think with the worry and the anxiety that she experiences, it's just different. And it's hard for me to see because I love her and I don't want her to be hurt, but she gets hurt very easily. Whereas my other daughter is like a neurosurgeon, and she's like, she's just a jerk. Neurosurgeons are classically just thick-skinned, kind of like, and so, but I love her. I think it's wonderful to see both of them. They're both very unique and wonderful. What would you advise to someone who maybe is in the empath space who might care a little too much about what other people are thinking?
Yeah. So, it's kind of a play on words with that idea of care, because there's our care is what we care about, what matters to us, where our values are, and then there's our cares, which also refers to our worries, right?
Sure.
So they really are two sides of the same coin. So if the daughter who's more of an empath, that's probably a real strength and a value, and it's just beautiful. And that she really cares about other people and where they're at, and she's probably really good at reading other people.
It's incredible. No, it is incredible.
So again, what a lovely strength to have, and what a beautiful value. But then there's the sort of part that comes along with it that, depending on how she practices that, it could cause a lot of pain. So if she is really thoughtful about other people and what do they think, and can kind of put herself in other people's shoes really easily, what is it that she's concerned about what they're thinking? Is it something about her? Or is it just she can feel their pain and she feels for them? Or is there some other piece to it that maybe could be modified or switched while she maintains the deep care for other people? But if she's starting like, I don't want someone to ever think that I don't care about them, that can put her in this place where she doesn't share her own opinions, or she doesn't set a boundary, and so it would be kind of getting into the details with her at the times when she is feeling really distressed of, okay, you're really concerned about X person. What is it that you're concerned about? This is going on for them. I really feel for them. Yeah, boy, that does sound, really painful. And anything else? Well, I'm thinking that if I don't do X, Y, and Z, they won't think I care about them, or I'm not doing enough. And that's where I would say it starts to bleed into what I would call over-responsibility. And for people who are chronically anxious, that is another pattern that is common, is this over-responsibility, and in particularly being over-responsible for other people's emotional states.
Yeah, totally.
And so
that's a huge thing. And she has all of the things that you mentioned, the difficulty process. She's been there. But this one especially, and my wife had this to some degree as well. And she's done some beautiful work here and has wonderful boundaries now. My daughter has wonderful boundaries against taking responsibility for your emotions. She's like, no, you go over there and whine as much as you want. I'm not taking responsibility for any of that. And it's cool to see such a strong boundary. So carry on. I'm sorry, this was wonderful. And I just wanted to mention that, she's been in all those states. And it puts her at a vulnerable...
the strength, there can be things interwoven that just need to be separated out. So I don't think you or she or myself would want to make her less empathetic.
No.
And that seems, again, like a beautiful thing to be and have a really a strength there. But there can be this then interwoven piece of, well, then I need to make everyone feel good, or I got to figure out this sort of over-responsibility for other people's emotions. So then you can work on that piece, kind of separate it out, modify that, while the other stays.
Cool.
Just like this other daughter you're mentioning, you're like, wow, she's like a neural surgeon, she's just doesn't care about anything kind of a thing. And that's probably, I know you say that in jest and it's not true. She cares about a lot of things.
Very loving. Yes. She's
so,
awesome.
But she's able to not take over responsibility, but there might be a way in which some of her boundaries are maybe too strong, or there might be something to weave out of that. Like, I can't let anyone ever affect me. It's like, well,
Right.
So being able to set good boundaries is, again, a wonderful capacity to have and something to have developed. But there might be something interwoven with it where I've got to be a stone so no one gets to me. That would probably not serve her well. I'm not saying she has that, but that's just an example.
I wonder if all parents should just be psychologists, because it is beautiful to help them in these emotional intelligence journeys. I'm lost sometimes, oftentimes. And I think it highlights the need for folks like you who can kind of help people with reframing and help people with recalibrating brain cells. And let me help you frame that a little differently. Like, it's beautiful that you have this talent set, but with that interweaves some weaknesses, and let's pull those out and just reframe them so that I see people like my daughter or my wife who are very empathetic and take emotional responsibility for other people's things. They're very prone to abuse, like in relationships, and because they're just like, oh, this is all my fault, and the reason that they feel this way is because of me, and so it's very it can be somewhat dangerous. I see some vulnerability there, and I'd like to shore that up with her. So I think it just highlights how wonderful it is to have folks like you in the community to do this kind of work with folks and our teenagers and our adults, and help us with recalibrating some of this. The deep work that we didn't kind of circle back on too much, but we did a little bit, I think is part of that, honestly. Like
that is the deep work.
Core, the core value beliefs
is kind of going into, okay, what's really happening for you here? Like, it's one thing to talk about earthquakes and worry, but that's sort of almost surface level in a way. And, underlying that are, like I want to take good care of my family, and I need to, always be prepared for them or something. That would be going into more the deeper. That's just a sort of a thing I pulled out of a hat with someone who's like maybe really worried about earthquakes. Maybe if you kind of take it down, what they really, worried about is, I want to be a really good provider. Okay, well, that's a beautiful thing. But how is that playing out? What does it mean to be a good provider? And are you then, one that I get a lot is, well, I got to keep anything bad from happening from my family. Well, wow. I mean, if that's your definition of what a good provider is, that's going to cause you some problems and a lot of anxiety, and also probably a sense of failure because and anger, right? Because you're not going to be able to keep bad things from happening to your family.
That was me. I had to figure that out. I had to figure out how to not be a jerk, and how to not take responsibility for, all these things that I couldn't control. And I'm trying to be a good dad, but I don't have to be a perfect dad, and my kids don't have to be perfect kids either. But putting my head there, being raised in a very dictatorial family was really tough. And so that was some deep work that I had to figure out. And I've done better. And my second two kids are much better. It's just great. My first one, we mess up pretty bad. And the next one, we kind of do okay on. And then the last two, we kind of get things figured out as parents. And Dr. Spangler, I'd like for you to put a plug in for your practice, for your counseling practice, if you will. Tell us about it. Sure.
So I have a private practice in Provo, and I can give you the number to put in show notes for anyone that would, and they can just call that number if someone would like to see me.
Just Diane Spangler, is that the best way to find you?
Yes. Mm-hmm.
Okay. And you have a website or anything?
Yes. There's a website under Cognitive FX.
Okay, cool.
Yeah.
Yeah. Awesome. Well, thank you. Thanks for all the work you do. And we've referred some clients to you, and we really appreciate your help with them. And anything in closing, I think this has been wonderful. It's been wonderful for me. I've learned a lot of cool things, and hopefully our listeners are also learning and growing. But that's our intention with this podcast, is just to help the community.
Well, if I'm going to stay on the anxiety theme, I'd say honor it for what it's worth, for what its purpose is. But there's a way out of if it's kind of taken over your life.
Beautiful. Yeah. Thank you. Thank you.
To our listeners, thank you for tuning in today, and like and subscribe. Thanks.